If you have hip osteoarthritis and you want less pain and better function, keep watching. By the end of this video, you will have three things: a better understanding of hip osteoarthritis as a whole joint condition, knowledge of the best treatments for hip osteoarthritis and the ones you should be avoiding, and thirdly, a collection of hip-specific exercises you can get started with today. Hey, it's Jack and Mitch from Be Mobile, and as physiotherapists who work with adults 55 plus, it's fair to say we see our share of hip osteoarthritis,
Sure do.
which we're going to refer to in this video as hip OA.
But what is hip OA? It is a condition of the hip characterized by symptoms of increased pain, stiffness, sometimes swelling, and feelings of instability. Typically, hip OA presents as pain on movements such as walking, especially upstairs, or squatting or bending down to pick something up off the ground.
Yeah, and clients will often tell us that they get pain after sitting for long periods of time, whether that's after a big car trip or a plane trip. And they often describe the pain as deep hip joint pain at the front of the hip there, or maybe groin pain, but they can also have pain on the side and the back of the hip as well.
Yeah, and not just the pain, there's also often the stiffness.
Yeah.
And they'll often feel this in the morning. So maybe it's a little bit better when you get up and have a hot shower or move around a little bit.
That's right. And there's some reduced range of motion in the joint as well, particularly when you're doing such activities as putting your socks on when you're having to get your leg up internally, externally rotate your hip. But also when you're walking, you might feel you have less extension when you're kind of striding out. Now, on imaging such as MRI or X-ray, we might find that there are changes in the cartilage of the hip joint. But it's important to note that this is a condition which affects the whole joint. So we might also see some changes in the bones, the tendons and ligaments, the muscles around the hip, and also the acetabular or hip socket.
Traditionally, hip OA has been diagnosed using scans such as X-rays and MRIs. However, we now know that you don't actually need these scans to diagnose hip osteoarthritis.
Yeah, we could have a client who comes in with lots of pain and stiffness in their hip. However, on scans, there are minimal findings. And on the flip side of that, we might have someone who comes in with minimal pain and stiffness with lots of scan findings.
Yeah, so the important thing to remember is that it's not the scan that diagnoses it. What's much more important is your symptoms and your function.
Now, it's important to be aware of all the treatments out there for hip OA because not all treatments are equal. There are costs and benefits to all of them. Now, we're going to be referring to the treatments outlined in the guidelines from the Royal Australian College of General Practitioners. They bring together all the best evidence surrounding management of hip OA.
Yes, and the strongest recommendations from those guidelines are lifestyle-related changes.
Right.
So it's weight management, education, and land-based exercises.
Weight loss is a strong recommendation in the guidelines for those who are overweight or obese. You can reduce the load on your hip joint, but also the bodily inflammation associated with excess fat mass.
Education is basically understanding what hip OA is, what the treatments are, what you can do about it, exactly what you're doing by watching this video, so good on you.
Yeah, and perhaps the strongest recommendation from the guidelines is doing land-based exercise. So that includes things like walking, strength training, and we're going to be showing you some exercises in just a minute, and other exercises such as Tai Chi.
Now, you can also do some supplementary water activity. However, do remember that we live on land, so your best bang for the buck is going to come from land-based strength exercises, and we're going to show you 5 of those in just a tick, so just make sure you stick around.
The lifestyle interventions we've just been talking about are your first line of treatment. However, there are other self-management strategies such as using hot water bottles or heat packs for pain management, or getting things like manual therapy like massage for short-term pain management.
Non-steroidal anti-inflammatories or ibuprofen can also be recommended at low doses for short periods, but always chat to your doctor or pharmacist first.
Now, the guidelines recommend against treatments such as therapeutic ultrasound, shockwave therapy, expensive footwear marketed for people with hip OA, and supplements such as glucosamine, fish oil, or turmeric.
There just isn't the evidence to support these types of treatments. And it's important to remember you've only got limited time and money, so you best focus on the things like land-based exercise that not only have the most evidence, but also empower you to take control of your own condition. So stick around, we'll get to those very shortly.
All right, what about a hip replacement? Well, this is certainly an option for some people, but it shouldn't be your first option. There are lots of risks associated with surgery, and there is financial cost.
So the guidelines recommend doing your exercise, managing your weight, and educating yourself. If you've done this for a good amount of time, but you're not seeing the results, well, then chat to your doctor and your local physio, and then you can make a considered decision. But do remember, either way, if you've done the hard work before the surgery, you're going to have a better result on the other side.
Okay, let's get into the 5 hip exercises that you can do at home today to get started. Now, before we start, it's always important to remember that you should try to keep the exercises tolerable and manageable and find a good starting point for you. I mean, Mitch, as we see with clients all the time, you might get pain during these exercises, but if it's tolerable, you're okay to continue.
Yeah, just ease into it, and often what you'll find is it lessens over time.
Okay, let's get into the first exercises, which is hip abduction or a standing side leg raise. Okay, so Mitch, show us what that looks like. So hanging onto a bench.
Yeah, grab a chair or a bench, stand up tall, and you're simply going to take your leg out to the side. Yep. Now, this is one of the movements that people with hip arthritis often find difficult, which is why we're doing it. So we can desensitize that movement for you.
Okay, so Mitch is holding his right leg off the ground, the one that's being raised, obviously. So he's making sure that it's off the ground the whole time, and he's just bringing it out to a tolerable level. Because you might start and just get a very small range of motion going, and that's fine. Or if you're coping with that, let's pull the leg out a little bit further. Okay? Now, Mitch, are you feeling it in both sides of your hip?
Yes. So you're going to get the muscles here, you're going to feel it, but you actually feel a lot of effort on the standing leg, which is also why it's such a good exercise.
Yeah, so working all of those hip muscles in and around your joint there that are going to help stabilize it when you're doing single leg activities, okay? Now, the next part about that is to add a pause to make it harder. So if that wasn't hard enough, Mitch is going to pause at the very outside of the movement. So go back down, and he's going to come out, pause for 1, 2, and then move back. And that extra 2 seconds added to each repetition certainly makes it harder, doesn't it, mate?
Definitely. And because you feel both legs, it's really important that, let's say you have hip arthritis on your right leg, do this exercise on both sides, because when your right leg's in the air, you're getting the range of motion benefit as well as some muscles. But then when it's on the ground and the left's working, it's doing a lot of work to help stabilize you.
Okay, great. So that's a standing side leg raise or hip abduction. Let's go through split squats now. Exercise number 2. I'll jump over the side, mate.
The chair, mate. Okay, so split squats, we're going to use some...
So regular version first.
We'll do it without the cushions first. So split squat's really good as an alternative to a squat. You can see here, Jack's legs are split. He's lowering that knee down to the ground, like so. Now, the split squat's a good variation to the normal squat, because we often find that clients with the normal squat sometimes have a bit of difficulty pinching in the hip or groin.
Yeah, because you can keep your torso upright, so it tends to be a little bit more tolerable. Yep. Where do we start with this, mate?
So an easier version is going to put some pillows or cushions under your knee, and you're going to aim to get down towards those cushions. So you can make it as hard or easy as you like by how many cushions you have in the house.
Right, so I'm focusing on getting my back knee to touch the cushions. Now, I've got 2 cushions. You might have 3 or 4. Yep. Be doing really shallow ones. So start shallow. The other thing is to make sure that you're getting a big enough split in your stance. So if you do a tiny little split and you find, I'm really cramped up, take a bigger step.
Yeah, we'll show them side on.
Might be easier for sure.
You see there, Jack's keeping his torso up, so you don't want to be doing this. So show him there, Jack. That's it. So his torso is nice and upright, back knee going down to the ground. Now, your symptoms might determine how much of a split you can have. So it's okay to modify that based on your symptoms. If it needs to be a bit more compressed, that's okay. Yeah. Just find the sweet spot for you.
Okay, now as you progress over time, maybe you're able to start like this. You can take away cushions and get closer and closer to the ground. Because remember, these are for strengthening your hips, but it's also good for getting up off the ground in your daily life.
Great. And you're going to get strength benefit in both legs, but you're also getting some range of motion benefits, especially in that back leg. Now, some people will find their symptomatic leg is more difficult when it's at the front. Yep. Some people will find it's more difficult when it's at the back.
That's right.
There's no set rule. It's going to be a little bit different for everyone. So just work around that, do what's tolerable.
And once you've found that you can do it without the chair, we'll then take that away. You can do it freestanding split squat. And of course, over time, you can hold weight with that exercise, but we recommend starting just body weight, especially when first starting it. Exercise number 3 is the glute bridge. This is a super simple exercise. You can do fully body weight, and it's going to be great at working the muscles in and around your hip. Okay, so all I'm going to do is tuck my feet in towards my bottom, hands by my side, head back, and I'm just going to lift my hips up to the sky. And I want to do it so that I almost have a straight line in between my knee and my shoulders, as you can see there. And I'm really going to feel this exercise in my glutes there, okay? Maybe in my hamstrings. Might even feel it a little bit in your lower back, which is fine as well. We find this is a very tolerable exercise for people with hip osteoarthritis. Now, if you are getting a bit of pain at the very top of the movement, just back off a little bit and come down, okay? So you're not going up so high. We're still getting a bit of work done, but it's just a bit more tolerable perhaps for you. Okay, so that's the starting version. If you want to make that a little harder, grab a chair, or this could be a couch or anything similar, and all we're going to do is bring our feet up onto the couch, just like this, dig our heels in, and from here we're doing the same thing. Same principles apply. We're lifting our hips, and now I'm going to have a straight line from my knee to my shoulders, as you can see there. Now, with this version, it is obviously harder. I'm feeling it a lot in the glutes, a lot in the hamstrings, but also my calf muscles. Just like that. So I'm increasing the range of movement that I'm doing by putting my feet up on the chair. And that is a great exercise where you don't really need any equipment, and that is the glute bridge. We hope this video is reassuring, knowing that there's lots you can do about your hip OA, so that we can continue to give you the education and exercise that you need. Make sure you subscribe to our channel. All right, our final 2 exercises, let's get into them. The first is step-ups. This is a super simple, self-explanatory exercise, isn't it, Mitch? And you can find where you can either have a step up like this you might have as part of your exercise equipment, or any step in your house or community.
Yeah, and you can see what I'm doing here is making sure that each leg gets a turn of being the lead leg. So first time I did left, now I'm doing it with the right.
Yeah, now step-ups can be rather bothersome for people in their daily lives if they have hip OA. We often find that from clients, but if you're able to practice these and challenge yourself in a tolerable way, that can translate into your daily life and make steps easier, so that you can continue to walk up those set of stairs, go for a hike in the bush, those types of things. Now, Mitch, how can we make this easier?
So we can make this easier by lowering the height of the step. If you do have a height adjustable step, I'm not going to take those off now because they get very stuck on. We don't have time for that in this video, I don't think.
No.
Or finding a lower step. If you're not using an adjustable step, you're on a bottom flight of stairs, just sometimes you'll find a narrower step as opposed to a really high step.
Yeah, and you can also hold on to a handrail to give yourself some hand assist as well, okay? Then make that harder because you want more of a challenge and you're tolerating it well. You can increase the step height, so do some bigger steps, as Mitch has already talked about, or you could add weight. So you could chuck a backpack on, okay? And maybe start with something like, 5 kilos, especially if you're someone who likes getting outdoors and hiking, and then do your sets of step-ups with some weight. And then alternatively, obviously, take the weight away. Give me back my backpack, mate.
I was waiting for you to pass me an extra weight to make it harder.
Not yet, to make it easier. Yeah. Okay, so that's the step-up. Super simple but effective exercise.
Yes, very effective. Seems almost too easy, but it's such a good one.
Okay, let's go through exercise number 2 here, Mitch, which is the Romanian deadlift. I can demonstrate that, mate.
Sure. So Romanian deadlift, Jack will demonstrate here. Really great exercise for working the hips and the hamstrings. You see he's going to bend over at the hips like he's bowing. So it's different to a squat. Here it's more, the bend is occurring at the hips. You can see as he bends down, brings the weight back up. Now, mate, what are the main cues to be mindful of with where you're holding your weight? Any other tips?
Yeah, so Mitch said the word bowing. I love that cue. So I'm getting my chest towards the floor, bowing, keeping the weight close to my legs, as you can see here from this side view. And I can really feel it in my calves a little bit, my hamstrings, definitely my glutes, all those muscles that insert in and around the hip.
Yeah, and your lower back. So it's really good for improving your ability to bend over, pick things up off the ground, carry grandkids, all those activities which can get a bit tricky when you've got hip arthritis.
Yeah, and to make it a little bit easier, you can, first things first is carry a lighter weight, but you could change the range of motion. So do a smaller movement here at the hips.
Not coming down as far.
Yeah. and then I can increase the range of motion as time goes on. Mate, I can also use a backpack.
Yeah, so if you don't have weights at home, backpack with books or anything in there. See, Jack, same movement, going down. You just find out how it feels most comfortable to hold it.
Yeah, because often people bending over might find the pain at the front of the hip if they have hip osteoarthritis. So this can be a great one to get you used to that movement.
Yep.
Okay, now for all of these exercises, we recommend doing 3 lots of between 12 and 15 repetitions, following the twice a week rule as according to the guidelines for strength training. Okay, just make sure that these are all tolerable and manageable.
We hope that you found that video reassuring, knowing that there is lots you can do about your hip arthritis. But the next step is to get started, and you can do that by putting these exercises into practice today.
Oh, and make sure you leave a comment below letting us know what activities you find most difficult with hip OA so that we can create more videos like these to help you overcome them.